Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. Concurrent criterion-related validity is used as a substitute for predictive measures. Concurrent validation is used for instruments or tests employed to diagnose existing states rather than for prediction of future outcomes. Keep in mind that the criterion is always available at the time of testing with concurrent criterion-related validity. What are the differences between predictive versus concurrent criterion-related validity? Let us answer this question by examples. Is John likely to become schizophrenic? Predictive. Is John schizophrenic? Concurrent. Is Sally likely to be successful in graduate school? Predictive. Is Sally successful in graduate school? Concurrent. Is Howard likely to be a safe nurse? Predictive. Is Howard a safe nurse? Concurrent. Please be aware that the criterion used in such procedures may be contaminated. For example, a subject's test scores must not influence his or her criterion status. For example, a nursing faculty member's knowledge of a student's test score or scores must not influence his or her clinical performance rating of that student. Thus, it is important that raters of subjects do not have knowledge of test scores, since criterion ratings may become contaminated by such knowledge. There are several commonly used criteria to validate tests or instruments. For example, criteria used to ascertain academic achievement include final course grades, grade point average, and others. Aptitude tests are used as criteria for performance in specialized training. Aptitude tests, personality tests, specialized skills knowledge tests, for example, the ANCC, AANP board tests, the NCLEX-RN test, and others, are used as criteria for job performance. A test or instrument may be validated against as many criteria as there are specific uses for it. Psychiatric diagnoses, for example, can be used as criteria to document concurrent validation of an instrument designed to measure such diagnoses, or an instrument may be designed to predict psychiatric diagnoses. Ratings of performance may be used as criteria for concurrent validation of an instrument, or, again, a performance rating may be the criterion that an instrument or test seeks to predict. Construct validity is the extent to which a test or instrument may be used to measure a theoretical construct or trait, for example, clinical depression. Basically, does the instrument measure the theoretical construct that it purports to measure? Each construct is developed to explain and organize response consistencies to a test or instrument. Constructs are complex abstractions. Each construct derives from established interrelationships among behavioral measures. In exploring construct validity of an instrument or test, an investigator must consider age differentiation, correlation of test scores with other tests, that is, correlation between the new test and older, more established tests, factor analysis techniques, which are used to determine the various subcomponents of a construct of interest, and internal consistency tests, that is, item-to-item scores in the instrument and sub-test scores to total scores in the instrument. Two additional construct validity techniques include convergent validation and divergent validation, or discriminant validation. In concurrent validation, scores on the test or instrument must correlate highly with other variables that are theoretically linked to it. For example, in my own experience with instrument development, the construct hopelessness correlated with my construct of interest, learned helplessness. This high correlation provided additional construct validity to my learned helplessness scale. Indiscriminate validation, scores on the test or instrument should not correlate with variables from which it theoretically differs. For example, scores on an optimism hopefulness scale should not correlate with scales on a test of despair. Which validation procedure should a researcher use to validate an instrument or test used to measure a variable in a study? Importantly, the choice of a validation procedure for an instrument or test depends upon the use to be made of the test scores. For example, if SAT scores are to be used to predict subsequent college performance, then SAT scores need to be validated against the criterion of college performance rather than solely in terms of content validity. In my past academic administration experience, I collected graduate students' GRE scores and GPAs at graduation from their graduate program to determine if GRE scores predicted GPA at graduation. Since they did not predict GPA at graduation, I eliminated GREs as an entrance requirement. Again, researchers must carefully consider the use to be made of test scores before planning validation procedures. As examples, look at these situations. First, Sally's final course grade may be used to answer the question, how much has Sally learned in this course? This is an example of content-related validity. Second, the National League for Nursing test or some other test may be used to predict performance on the NCLEX-RN examination. Thus, the NLN test grade may be used to predict Sally's performance on the NCLEX-RN licensing exam. How well will Sally perform on the NCLEX-RN example? This is an example of predictive criterion-related validity. Third, for a test to determine presence of learning disabilities, the question may be asked, does Sally's performance on this test indicate a learning disability? Sally may be independently tested for learning disabilities using other existing tests, and correlational analyses between test scores can be determined to indicate concurrent criterion-related validity of the new test. Fourth, for a test of critical thinking, the question may be, how can we categorize Sally's critical thinking abilities? This is an example of construct-related validity. Reliability is the consistency of scores on a test or instrument obtained by the same person, 1, with the same test on different situations, 2, with different sets of equivalent items, or 3, under other variable examining conditions. Like validity, a test or instrument must be deemed reliable in order to be used in research projects. A statement of reliability must accompany an instrument or test used in research. This statement characterizes the test when administered under standard conditions and given to persons similar to those constituting the normative sample. The characteristics of the normative sample should be specified together with the type or types of reliability used in developing the test or instrument. The normative sample is the group of individuals included in the original investigation of the instrument's reliability and validity. The characteristics of the participants in the normative sample used for initial data collection and analysis must be specified. Variables commonly described include age, gender, ethnicity, race, and others. An instrument can only be used on future samples that reflect the characteristics of the normal sample. Findings can only be externally generalized to a population similar to that of the normative sample. Correlation coefficients obtained between scores on a test or instrument and some other existing instrument are correlation coefficients. The Pearson product moment correlation coefficient, or simply put, lowercase r, expresses the degree of correspondence or relationship between two sets of continuous scores. Lowercase r is between 0 and 1 and can be positive or negative. An r considered acceptable in behavioral sciences is usually r greater than 0.70. We will explore this again in future sessions. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.